All right. So I'm going to be talking about the analyze portion of the Ihuman site. Right here we have how to analyze all the patient's expert findings that we had earlier. So he had pale skin. I unfortunately did this part already and I can't go back and do that, but it'll allow you to categorize what type of problem that the patient had. So for instance, Aaron had a pale skin. This would be an acute problem, or would this be a worsening problem, or would this be a no change problem, or would this be a problem? They let you categorize it in those ways. So, for instance, for the sake of this video, I just kind of played with this, and I put that pale skin was an acute problem, and then the expert findings, once you compare it to what the expert suggested, well, it told me that that was incorrect, and that is actually a worsening problem. So it'll also explain to you why certain things were acute, why it had no change, why it was worsening, why it was a resolving problem, or it was a resolved problem. So that will show the explanation here. When you go to the next drop down, it talks about identify client problems. And in this area, you're going to take all the experts' findings and categorize what type of problems they actually are. So it allowed me to see everything once again and now categorize them in more of a depth. So pale skin, I thought that was an oxygenation problem. So I went right here on this side and I pressed oxygenation problem. The patient was also in a tripod position, which I believed was a oxygenation problem. If you go ahead and scroll up and down here, you can see acid-base problem, behavior problem, CNS problem, comfort problem, and it goes more, has more drop downs here. If you have any trouble remembering, it tells you the definition right here. So for instance, activity, rest, and mobility, it'll give you the explanation. It says refers to the balance between activity, a complex process of coordination between the musculoskeletal and nervous systems. So that's how you go ahead and define each category. For the tripod position, little Aaron being in this position, I believed it was going to be an oxygenation problem. So you go ahead and click, and there you go. This is what I chose for each problem here. Then you're going to go ahead and press compare with the expert down here. You say yes, and then it'll give you the expert's feedback. For pale skin, I thought it was an oxygenation problem, and it tells me I'm correct, and it'll tell you why. For a critical condition, I thought it was I did actually not try to put communication, but it shows that I put communication, and then it'll tell you the definition there. So after that, you will go press next to prioritizing problem, which is the other drop down right over here. And prioritizing problem, this is what of these problems is priority. So you need to pick one. Or in this case, it allows you to pick two. So we have critical condition, we have limited access to emergency inhaler, and all these oxygenation problems. And then comfort problems, which is he had chest pain or history of chest pain. So below, select one of the problem categories in the column and drag it to the boxes in order of priority. So out of all of these, which is priority right now? I believe that oxygenation is priority because we need to have a little air to breathe. And I believe that comfort would be the second priority problem because if he has pain, we want to go ahead and make him feel as good as he can, fast as we can. So you'd press compare with expert. Yes. And it'll show you if you were correct. So oxygenation, it'll say yes, that's correct, and it'll explain why. The second I put for comfort, it'll tell you yes, you're correct, and it'll explain why it was correct for comfort. So next, after pressing this drop down here, it's going to take you to the next category of actions. So for actions, now we're going to go ahead and put some actions to our findings. We have our findings right here. And then it'll show you multiple actions. So for this part, let's just say, pale skin. What actions can we do for this pale skin? Just so you know, some findings will not have any actions at all. And some findings will have multiple actions that you need to apply. That's just for the sake of this video. He has, let's just say for pale skin. Let's go ahead and you can type here, oxygenation, maybe oxygen. Here we go. It shows the oxygen here. Maybe administer supplemental oxygen. We can apply that action because he has pale skin, which is a signification he needs oxygen. And so on and so forth. You would do actions for each finding here. Let's compare with the expert. And you can look right here. The green means actions that both you and the expert selected. Yellow means actions you should have selected. The white with a little black moon here, it says actions you selected but the expert did not. So for pale skin, that was the problem. The expert's feedback tells you here. I put administer supplemental oxygen as an action for that pale skin. And I guess this is the expert did not choose this. And then it shows here that the actions I should have selected for these two other problems, dyspnea and chest pain. So the next is to prioritize these actions. You press next, prioritize actions down here. It'll take you to the second drop down. And here, these actions need to be categorized in urgency. So it'll show you, do you need to do this stat? Does this action need to be done urgently? Or does this action need to be done routinely? So you can go ahead and hover over the question mark. Stat, the definition of that would be this action needs to be completed within 15 minutes. Urgent, it'll show you that this action needs to be completed within 2 hours. And routine, the definition is the action must be completed before end of shift. So you can see here. Assess patency of oxygen delivery device. That's an action for dyspnea. Do you think this needs to be done within 15 minutes right away? Urgently within 2 hours, or needs to be routinely before and end of shift? For patency of oxygen delivery device, I believe it needs to be done stat, because if it's not patent, you're just wasting your time. Notify the doctor of conversational dyspnea. I think that's something that you need to do stat, so I would categorize it as stat. Notify the doctor if oxygen response is inadequate, so on and so forth. You would compare with expert. Okay, so it doesn't allow you to go past that if you didn't select any for each. For the sake of this video, I'm going to go ahead and just press stat for each one, okay? There we go. So you would compare with the expert's findings. And here it will tell you why certain things were stat, and why certain things were urgent, and why certain things were routine. And here was the expert's feedback. If you press next to nurse's notes, here is a selection drop down that will allow you to make a nurse note. So whatever it is that your instructor asks you to do, an example can be an assessment note, can be a SOAP note, a DAR note, etc. You would write it here to just get some explanation about what exactly your instructor wants. You would press this little hamburger menu here, case instructions, and it will go into further detail of what exactly your instructor wants. So you can put a little DAR note here. Just pretend I put a DAR note there, and you would compare with the expert. Before we go to the next part, just remember that these experts' findings on the left-hand side right here can help you with making this DAR note or SOAP note or whatever note it is that you're going to make. You would compare with the expert, yes, and it will show you the expert's feedback. So here in this case, he completed a S-bar, and it will show you the situation, background, assessment, and recommendations. So next you would hit submit and review summary. And this is the ultimate summary at this point. We've already submitted your case. So here it will show you what exactly happened to the patient, their learning outcomes, the discharge teachings, what the patient had. In my case, Erin had asthma, some nursing pearls for you, and it'll go into depth on some of the pharmacology that we used for the patient. If you hover over here, it'll also show you some references about what articles were actually used to make this case happen. And you can go ahead and link or look these up and look into depth with that. Okay, if you go to see evaluation down here, it'll show you the total amount time spent doing this case. It will show you the total score for each area, like history, the physical assessment. And then right here, these two drop downs are not going to be graded because this is something that your instructor has to grade you on. If you want, you can go back and hover over any of these, or hover over any of these and look into depth about your findings and your results, and just review that. All right, so that's it for this section.